Hello guys, welcome back to my channel. I'm Savannah's health and fitness coach who's qualified in clinical nutrition. Guys, if this is your first time you coming across this channel, please don't forget to touch the like and subscribe button and make sure you share these videos. There's a lot of people that may need to see it. Today we're talking about high blood pressure. High blood pressure has been around for a long time and it's a common problem. A lot of people have high blood pressure, especially people in their middle age to the older ages. Sometimes young people have it, but it's much more common in people in middle age to older ages. The basic problem with high blood pressure is that you have stiffness in your arteries. So when your heart contracts to push the blood around, your arteries does not dilate very well to allow the blood flow freely. So there are a few reasons why this happens. Most of the time they've blamed it on salt, poor diet and lack of exercise. So if we take it from those three perspectives, let's start from salt. Yes, salt can be a problem if you're eating excessive amount of salt and you're eating the bleached up iodized salt in that white long container. You know what it looks like in the shops. So yes, that can be a problem. If you're eating excessive amount of that salt, it can cause you hardening of the arteries and you run into these kind of problems and even other problems. But if you're eating pink Himalayan sea salt in normal amounts, you most likely would not see salt as the problem. The true problem why salt is causing this problem is because of lack of potassium. We need to understand that sodium, which is salt, and potassium, which is a mineral that we need, they work together. So we need to have more potassium than sodium. We need about 4,700 milligrams of potassium a day. So if you have too much sodium and less potassium, then you're gonna run into all sorts of problems. So you need more potassium than sodium. So potassium foods include figs, avocados, green leafy vegetables like broccoli, spinach, kale, Swiss chard. These are all high in potassium. So if you have enough potassium and less sodium, you would not you lower your high blood pressure. Another problem they blame it on is poor diet. Yes, poor diets can be a severe problem. Most people all their life they are used or they're conditioned to eating a lot of carbohydrates and processed foods. Well, some people don't eat processed foods, but they eat high carbohydrates. Over time, you develop insulin resistance because of your lack of activity. As we all know by now, carbohydrates are strictly energy giving. They're energy giving foods, nothing else. They're not really essential. So if you eat a lot of carbohydrates, make sure you're doing a lot of exercise. If you're not doing a lot of exercise, then you have no reason to eat a lot of carbohydrates. So people over the years, they eat a lot of carbohydrates with lack of exercise. This leads them to a situation where they have a resistance to insulin and they start putting on weight. And that in turn results in other problems like high blood pressure, metabolic disease, and other things. So you can see the link between carbohydrates or processed foods and all these other diseases, including high blood pressure. So yes, when they say poor diet, you could be eating vegetables and because some people, I've seen people, when you tell them, well, your diet is not good, they say, oh, what I eat is just rice and bread and that and that and that. Well, that could be causing you the problem because you're not matching up. The amount of those things you're eating is not equating to the amount of exercise. So you leave a room for them to cause a lot of damage. So now you need to lower the amount of carbohydrate you're eating because you already have high blood pressure. And if you want to lower your blood pressure, you need to lower the amount of carbohydrate you're eating and totally stop eating processed and refined foods. The third reason could be lack of exercise. Lack of exercise definitely does play a role. As I've said, if you're not exercising, then you shouldn't be eating that much carbohydrates anyway. But exercise is needed regardless of who you are. It doesn't matter. Not only to lose weight, exercise is important for a lot of other reasons. And including lowering your blood pressure. So you definitely need exercise. So that is a factor that is very important to lower your high blood pressure. Now, there are other things that are important that plays into lowering your high blood pressure. Now, apart from potassium, which is a very important mineral to lower your blood pressure, there's magnesium. Magnesium is needed to lower your blood pressure. It's a natural relaxer. Magnesium is a natural relaxer. You can also get magnesium from leafy greens, that is vegetables like broccoli, kale, spinach, all these green leafy vegetables. They have a lot of magnesium. Vitamin K2, which you get from grass-fed butter like Kerrygold. You get it from grass-fed meat, right? This all help to lower your blood pressure. What vitamin K2 does, it takes calcium from the soft tissues and puts it in the bone, because calcium is needed in your body, but if calcium is left to wander around on its own, it's going to stick around in the soft tissues and cause a lot of problem. So vitamin K2 helps to get calcium off the soft tissues and put it back in the bone. So that is very important. We also need CoQ10, which is another important components to lower your blood pressure, and omega-3s. So omega-3s is usually from fatty fish like sardines and salmons. By now, if you've been watching my video, you know that. Also, CoQ10, you can get it from meat, especially grass-fed meat. Don't have to eat a lot of it. You know, once every 2 weeks, you have a good quality grass-fed meat. That should be enough. So the final take on this is that to lower your blood pressure, you need to eat fruits, vegetables, antioxidants. Remember, I said fruits, but not sweet fruits. Your fruit consumption should not be that much. So we're talking about fruits, vegetables, omega-3s, CoQ10, magnesium, and vitamin K2. You can also get this in supplement form, but the problem I have with most supplements out there is now they're synthetic, and it's not exactly the same thing as the original thing, which is why I say it's best you eat the food. When you eat the food, you get the full vitamin complex as how it's needed in your body in nature, than buying a synthetic one that's been prepared in the lab, and it's not exactly the same thing as how nature made it. So you don't want to do that. Most people have been on medication, and they've been taking medication to lower their high blood pressure. So when their blood pressure go up, they run and take a medication. Okay, that can help if you are in a situation that if you're in a very tight situation and your blood pressure is so high that you might lose your life, then yeah, take the medication. But remember, high blood pressure medication, like any other medication, has very severe side effects. They also deplete some of these minerals I've just mentioned, some of these minerals and vitamins I've just mentioned, which keep you in a loop of your blood pressure going high again. So you need to take them. So it's like a vicious loop that you're going around. You take the blood pressure medication, it keeps depleting the minerals, and plus your diet might not be great, but even if it's great, you already have the problem of high blood pressure. So I'm not saying come off your medication. You might want to speak to your doctor about that you want to start eating properly and observing certain things that would naturally lower your blood pressure. And then you see how you two can work out in slowly lowering the medication until you come out of it. But anyway, guys, so that's the take for the high blood pressure. I hope you learned something from this video, and see you next time. Have a good day.